you've got a child that has moderate to severe persistent asthma and they have already used a bunch of medications without control, there's a good likelihood that your pediatrician or family physician is going to start you on something like an Advair Diskus. Now, an Advair Diskus combines two medications inside it: salmeterol, which is a long-acting form of bronchodilator, and an inhaled steroid. In this case, it's fluticasone. Now, if you're using an Advair Diskus, this is considered a dry powder inhaler, and you actually have to have a good technique for getting the medication out of this discus into your lungs. Now, what you're expected to do is to take your device and open it. When you open it, you notice that there's a mouthpiece, and the mouthpiece usually should have a flap, which, if you can see it there, is closed. There's a little lever here that you can move, and once you pop this lever back, you can now see that the top is open. Now, because this medication is a powder, it sits in the device and doesn't come out, but that also means that you can't turn it over because you'll lose all your medication. So right now this medication is loaded and ready to go. Once it's in this state, what I'm going to do is I'm actually going to blow all the air in my lungs out, not over the mouthpiece, but just to the side. When my lungs are empty, I'm going to put this device over my mouth and I'm going to inhale. I'm then going to hold my breath for about 10 seconds so the medication can get into my lungs and settle in there. And then I will exhale, and that's how you use an Advair Diskus. Now, in case you were wondering, this is just a demonstrator device, so there's no medication in it, so I'm not that crazy to use all the medicine on myself. So, here we go. Now, if you notice something, I didn't go, because if I had done that, remember it's a powder, I would have sucked it all in too fast, and most of it would probably have just stuck to the roof of my mouth or the back of my throat and wouldn't have made it to my lungs. And if I had gone too slowly, I wouldn't have been able to create the drag required to get the medication into my lungs. In both cases, I would probably have complained to my doctor that I taste the medicine too much in my mouth and I don't like how it tastes. But if that's happening, then it means you're probably not applying the right amount of drag. So remember what we did. We had the whole device closed up, opened it, opened the flap, breathe out, and that's the right way to use an Advair Diskus.